Young onset Alzheimer's disease is when Alzheimer's disease starts before the age 65. Typical Alzheimer's disease is when it starts after age 65.
And it would interfere with some little parts of her job, particularly toward the end of the day.
Yeah, there was a fatigue factor too.
Yeah.
And my dad had memory issues. So I had it on my radar about Alzheimer's disease.
Young onset Alzheimer's disease is caused by the buildup of toxic proteins in the brain, which lead to the shrinkage of brain structures that are important for memory and other cognitive functions.
It was probably about 3 years ago we saw Dr. Jonathan Graff-Radford.
So it really impacts families significantly, and it's important for them to get a diagnosis.
He felt he recognized that as mild cognitive impairment.
Most commonly, young onset Alzheimer's disease presents with a memory problem that's progressive over time.
I think at that time he asked Cindy to let her supervisor know about her situation.
They upgraded our computers around that time, and wow, that got things a little more difficult for me.
These could include problems with planning, organizing, or performing tasks at work.
Her supervisor observed just more difficulty and then suggested she see her neurologist again, and had a little deeper diagnosis at that time, dementia. And about 3 to 4 months later, another consult with Dr. Graff-Radford. He then used the term Alzheimer's disease in her diagnosis.
I think it hit him a little harder.
She was able to continue to work in a job she loved in patient education for several years after her diagnosis.
We can live with this. It's not everything. It's just some particular things. The brain works really interestingly.
That's true.
And Cindy still continues to do some things really well.
Mrs. Leonard is living with her husband, who is an outstanding care partner, and she remains very active in many ways. Before the pandemic started, she was exercising regularly at the gym because she knows that exercise is associated with slowing down cognitive decline. And she really engaged socially with her friends. She's no longer working, but she's actively engaged in research here at Mayo Clinic, and she comes every 6 months for her visits and has contributed a lot to the research community.
I'm just glad to move the science forward if I can.
There is hope for people living with dementia and their families. Every day, scientists understand more and more about when the disease starts, how it progresses, and what treatments are on the horizon.
Yeah, we've lost this and this and this, but we haven't lost this, and actually we've gained this. And we plan to live with this. And ask us questions. Don't be afraid. Don't be afraid to be around us, because we're going to keep living.